Hello, and thank you again for joining the Navigating PSYCKES Recipient Search for Population Health webinar. We're going to go ahead and get started for today. We have lots of material to get through in the next hour. My name is Hannah Ritz, and I'm an Assistant Research Scientist on the PSYCKES implementation team, and I'm joined by my colleague Dee Dee, who will be assisting me with Q&A today in order to help answer some of your questions. Before I get started with the presentation, I'd just like to point out that all of the phone lines have been muted to prevent background noise, but you can still ask questions during today's webinar by using the WebEx Q&A box, which is located to the right of your screen. If you're viewing the webinar in full screen mode, you'll hover your mouse over the green bar at the top of your screen and select the little drop-down arrow located on the far right, and then the Q&A option will be the first choice on your list. I'll pause throughout the webinar to answer your questions, and please make sure you're submitting all questions to the Q&A box to all panelists. We will not be monitoring the chat box today. Also, please keep in mind that these slides will be sent out to all attendees after the webinar. So here's the agenda for today. We'll be doing a quick overview of PSYCKES, which might be a review for some of you, and then we'll go into accessing client-level data. Next, we'll talk about recipient search, and here we'll be going over individual and group searches, the and/or logic within recipient search, our bulk population management views, and then we'll do some example searches. Next, we'll review how to enable consent using recipient search, and lastly, I'll provide some information on training and technical assistance and answer any final questions. So let's start with the PSYCKES overview. The PSYCKES application is an online web-based application that is secure and HIPAA compliant. The purpose of PSYCKES is for sharing Medicaid claims and encounter data, as well as other state administrative data. PSYCKES does this by putting this data into a user-friendly format, and the application is designed to support data-driven clinical decision-making, as well as quality improvement projects that some of your organizations might be enrolled in. We also have ongoing data updates, such as our bulk population management views, and we'll be going over those in detail in a few slides. We have the active PSYCKES registry status for the suicide care pathway, the high-risk list, and for COVID-19. In addition, we have the overdose risk, concurrent opioid, and benzodiazepine alert with a link to resources, and we also have the ACT reason for discharge. Next, we have some population filters in recipient search, including behavioral health, high need, high risk, dual Medicaid, and Medicare, and we also have some newly added social determinants of health filter within recipient search. So these are just some examples of our ongoing updates. So who's viewable in PSYCKES? The population available in PSYCKES is the Medicaid behavioral health population. So for Medicaid enrollees within New York State, this includes those who are currently or previously enrolled in Medicaid. This also includes those who are fee-for-service, have managed care claims, or those who are dual eligible. For the dual eligible folks, meaning those who have both Medicare and Medicaid, the information in PSYCKES will only be from Medicaid data at this time. To be considered in the Medicaid behavioral health population, a client would need to have at least one of the following billed to Medicaid: a psychiatric or substance use service, a psychiatric or substance use diagnosis, or any psychotropic medication billed to Medicaid. But once an individual is in our population, the information you will be able to see for them will be across the treatment spectrum, and we will review this in more detail on the next slide. So the clinical summary provides up to 5 years of data and is refreshed on a weekly basis. The information that we get comes from two different types of data sources. The first is from billing data, which includes Medicaid fee-for-service claims and managed care encounter data across treatment settings. The second source of information from other state administrative databases, which helps to provide a full clinical picture of the client. The time lag in PSYCKES can vary depending on a couple of things. First, it depends on the type of information. Something like pharmacy claims, we consider those to be pretty quick and timely, with a typical turnaround time of 45 days, or even a little less from the time the client picked up their prescription at the pharmacy to when it hits our application. However, things like inpatient and outpatient services can take a little longer from the time service occurred to the time you see it in PSYCKES. It also depends on how quickly providers bill for their services, and those bills then go to the managed care company, and then the managed care company gets that information and submits it to the Department of Health. So it depends on how quickly each organization turns these bills around. As I mentioned before, besides the Medicaid billing information that we have in the clinical summary, we also have other state administrative databases that feed into PSYCKES as well. These sources are considered more real-time since the lag here is 0 to 7 days. So here's a list of different data sources that we have and where we are getting that information from. I'll just point out a couple of these. We have New York City Department of Homeless Services data, This provides us with the shelter name, program type, placement date, exit reason, and shelter director contact information. There's also health home enrollment and care management provider information. We're getting that from DOH MAP. So if a person is in outreach or enrollment, we have the name of the health home and we have the name of the downstream care management provider. And then we have information coming from NIMERS, and this is going to show suicide attempt data. And this is one of the instances in PSYCKES where this will not be restricted to that 5-year look-back rule. So suicide attempt information is all available data, meaning even if an attempt occurred 10 years ago, it will still show up in the client's clinical summary. We also have managed care plan assigned primary care physician information, which is updated quarterly by DOH. And lastly, I'll mention that we have safety plans, screenings, and assessments, which are entered into PSYCKES by providers within MyChoice. So what is a quality indicator, also known as quality flags? OMH has identified a number of health conditions or treatment issues that are important enough that they're worth scrutinizing. What PSYCKES does is it tracks clients who are positive for one or more of these health conditions or treatment issues. This way, the provider, the managed care plan, or local county or state government leadership can be made aware and take necessary steps. These flags can assist with supporting clinical review as well as quality improvement. There are a number of indicators that are broken down into our indicator sets or buckets. When a client meets criteria for one or more of our applicable quality flags, the provider is then allowed to access that client's clinical summary. So here are some examples of our quality indicators. We have flags that are medication related, such as polypharmacy, and an example of this would be a client who is on multiple antipsychotics or multiple antidepressants. And then we have low adherence flags, and an example of low adherence would be a client who has schizophrenia and started an antipsychotic medication, but they didn't remain on that medication for 80% of their treatment period. We also have some hospital-related flags or acute care utilization flags, one of which is our high utilization indicator set, and this looks at clients who have had multiple hospitalizations within a year. We have readmission flags for clients who may be cycling in and out of hospitals. General medical related flags, for example, would include someone who is on an antipsychotic but hasn't received a diabetes screening. Or if someone hasn't had an outpatient medical visit in over a year, they would be flagged as well. Lastly, another example would be our eligible for Health Home Plus flags, such as eligible for Health Home Plus, no Health Home Plus service, and you can choose from the past 12 months or 3 months, and eligible for Health Home Plus, not Health Home enrolled. If you ever have any questions about why an individual is flagged or what a specific flag is looking at, we have the quality indicator technical specifications on our website on our quality indicators page. So I would recommend reviewing those first. And if you're still unsure or have any questions, you can always feel free to contact our help desk. So what are some PSYCKES use cases and why might people use the application? PSYCKES can be used to support quality improvement projects, and here you can use MyQI reports to see what clients are flagged for a specific quality indicator. Here, users can also look at prevalence rates and observe where there's opportunities for improvement. You can also filter this report by program levels, managed care plan, region, county, and more. PSYCKES can also be used for clinical review and decision making. So here you can look up individual clinical summaries in order to view their treatment history and services, and this can be helpful when doing intake, evaluation, or risk assessment and treatment planning for clients, and also when quality managers are doing case reviews. Lastly, PSYCKES can help identify cohorts of interest. This is where recipient search comes into play, and users can utilize recipient search to perform a wide variety of searches to answer questions regarding client service in your agency or hospital. The recipient search results page can also be exported to PDF or Excel. Now we're going to talk about different levels of access to client-level data. In PSYCKES, clients are assigned to your agency in one of 2 ways, either automatically or manually. When a client is automatically assigned to your agency, this means that the client has had a billed service at your agency within the past 9 months. When a client is manually assigned to your agency, this means that you've used the registrar menu or PHI access module to manually assign them to your organization. Here we have a couple of different options for manual attestation. You can attest in PSYCKES that the client has signed either a PSYCKES, BHCC, or DOH consent form. You can attest to a clinical emergency, which gives you access to the client's full clinical summary for 72 hours. You can attest that verbal consent was obtained, which gives you access to limited data, so no any protected information like SUD, HIV, family planning, and genetic information for 9 months after it was attested to in PSYCKES. And lastly, you can attest that the client is being served by or transferred to your organization. You can also use the Recipient Search Unique Identifier section to look up an individual client and manually link them to your organization based on consent, emergency, or attestation of service, and we'll go over this later on in the webinar. We also have a more in-depth webinar called Consent, Emergency, Quality Flag, PSYCKES Level of Access, which takes a deeper look into the enabling access to client-level data process in PSYCKES. Without signed consent, you're able to view a client's clinical summary if they're positive for an applicable quality indicator within PSYCKES and the client has had at least one billed service at your agency within the past 9 months. The reason for this is because there's a mandate to monitor the quality and safety for clients within the Medicaid program. Now, even though you're able to drill into the clinical summary for clients that have an applicable quality flag and have been billed for a service at your organization within the past 9 months, you will not be able to see the client's specially protected data, meaning it will be scrubbed from the clinical summary. Specially protected data includes substance use, HIV, genetic testing, and family planning information. Now, with signed consent, you have expanded access. Here you can search among all Medicaid enrollees in the behavioral health population, including those who aren't yet linked to your agency through Medicaid billing and aren't positive for a quality flag. If you've attested that signed consent has been obtained in PSYCKES, you'll also be able to view all available data for that client, including data with special protections. In the case of a clinical emergency, you'll also have the ability to view all available data for that client, including data with special protections. However, you'll only have the ability to view this data for 72 hours. Lastly, another advantage to obtaining signed consent, besides being able to see all available data, is that with consent, access to that client's data remains in effect until 3 years after the last billed service, or if the client chooses to withdraw their consent. So now we're going to take a look at the application, and I'm going to show you how to choose the PSYCKES home screen. But before we do that, do we have any questions, Dee Dee?
No questions at the moment, Hannah.
Perfect. Thanks, Dee Dee. If you've logged into PSYCKES before, you may be familiar with this page. The MyQI report screen, this is typically a user's homepage when logging into the application. However, depending on the kind of work that you do, you may not want this to be your homepage and the first screen that you land on. So to change your homepage, you would go to Settings up on the top right of the screen and select Change My Homepage. Here you'll see the various homepage options we have in PSYCKES. So for example, if you're someone who goes into PSYCKES to enter consents, you may want to choose the Manage PHI Access screen as your homepage. Or if you go into PSYCKES to search for cohorts of interest, you may want to select Recipient Search. Once you select a home screen you prefer, a green check mark will appear, and then you can select Save. Then once you log out and log back into PSYCKES, you'll see your updated homepage as the landing page when you log in. Before we go into example searches, I just wanted to give an overview of Recipient Search. Within Recipient Search, we have 2 options. We can look up a specific individual, or we can perform a group or cohort search of interest. To look up an individual and view their clinical summary, you will need to enter in one of the following unique identifiers: their Medicaid ID, Social Security number, or first name, last name, and date of birth. The Recipient Search Group Search feature allows you to perform a flexible search to identify a cohort served in your agency that meets the specific criteria you select for your search. Here you can search by age group, quality flag, AOT or HARP status, managed care plan, suicide attempt, ideation or self-harm history, county of fiscal responsibility, Health Home Plus eligible, social determinants of health, and more. You can also search for individuals that are taking psychotropic or non-psychotropic medications, people with specific behavioral health or medical diagnoses, and you can also search for people that are being served at a specific setting within your agency or an outside agency. For example, if you want to search for clients at your agency who are served by your health home or by any health home, you can do that within Recipient Search. So this is just a screenshot of a portion of the Recipient Search page, and the top part is where you'd perform your individual searches. The bottom portion is where you'd conduct your group or cohort searches. So to quickly review, we're highlighting here the portion of Recipient Search where you can search for one specific client. And again, you will need to search using a unique identifier such as the client's Medicaid ID, Social Security number, or first name, last name, and date of birth. In this case, I searched by Medicaid ID, and here we're using fake data for the purpose of this webinar. But you can see when using a unique identifier such as a Medicaid ID, this will typically return one result on the results page. Now you just want to confirm you've found the correct client, and once you've confirmed that, you can click on their name and drill into their clinical summary if you have the appropriate access. In this example, this client meets criteria for one of our applicable quality flags, and you can see in the current PHI access column that you have quality flag level of access for this client. This allows you to drill into their clinical summary since they have an applicable quality flag and your agency has served them within the past 9 months. If this client didn't have any applicable quality flags and you haven't served them in the past 9 months, consent wasn't obtained, and it wasn't a clinical emergency, their name would not be clickable and you would see no access in the current PHI access column. Here we're showing all of the different options that you have to perform a group search and recipient search. I know this can be a little overwhelming at first, but we're going to break it down section by section in the next 2 slides. Now, within recipient search, there are a couple of important pieces of information to keep in mind when performing searches. The first part is the and/or search logic. When you're making multiple selections within the same filter box, this creates an OR logic. In order to select multiple options, you would need to hold down your control key to do this. The OR logic means that recipients in the search results have one selection or the other. For example, if I went to the behavioral health diagnosis box, selected depression, and held down the control key and then selected schizophrenia, because these are both within the same behavioral health diagnoses box, the search results will display clients that have depression or schizophrenia, not both. In contrast to this, when you're making multiple selections from separate filter boxes, this creates an AND logic. This means that recipients will meet all of the selected criteria. For example, in the diagnosis section of recipient search, if I select schizophrenia within the behavioral health diagnosis box and then select type 1 diabetes from the medical diagnosis box, because these are from 2 different boxes, clients on the results page will have both schizophrenia and type 1 diabetes. Another important thing to keep in mind when using recipient search are the look-back periods. Different filter options have different look-back periods in which the data in that filter is updated. So just make sure to read the date at the top of the main filter box for reference. In some of the sections, you do have the ability to select a different look-back period from a drop-down menu. The default look-back period for medications, diagnoses, and service settings is the past 1 year as of the recipient search report date. However, other options include the past 6 months, 9 months, 2 years, 3 years, or a specific calendar year. I just want to note that if you do use the 6-month look-back period from the drop-down menu, please keep in mind that those results may not be as up-to-date since things like hospitalizations or other types of claims can take a few months to hit the application. Another thing important to keep in mind is the maximum number of rows displayed. So when you're running a search, the search results page will provide you with the total number of people that matched your search criteria, the filter selections you've included in your search, the name of the individuals that meet your criteria, and the ability to export your results page to PDF or Excel. Now, the default number of names displayed on the results page for people that meet your search criteria is 50. So if I run a report on clients who have any behavioral health diagnoses and my results are 100 clients, you will only see 50 names on the results page and when you export to PDF or Excel. If you'd like to see more than 50 names on the results page, you can select the Limits Results To drop-down located on the top and bottom right of Recipient Search and change the number of results listed. One last note I'd like to make is that certain data in PSYCKES has special protections. Again, this includes substance use, HIV, family planning, and genetic testing. When selecting a filter option within Recipient Search that contains data with special protections, your results page will look a bit different. The results page will include what we call a 3 count, or 3 different numbers rather than just one number at the top of the page. You will see the total number of people that have matched your search criteria, the number of clients excluded from your search results because you don't have their consent, and lastly, the number of clients included in your search results because you have their consent. And we'll do an example search of this in a few slides. So now we're going to jump back into the recipient search characteristics section. Again, you'll want to check the date at the top of each section. So in this example, this section was last updated on November 20th, 2023. So here we have a lot of different options. You can search by a specific age range or gender, race or ethnicity, And we also have the County of Fiscal Responsibility filter, which displays where an individual is registered to be receiving Medicaid funds from. A new special population section has been created in recipient search to accommodate the new social determinants of health section and to assist users in more easily locating high-need, high-risk population filters. The special population section contains filters currently in the PSYCKES application that have been relocated from the characteristics section. The special population section will include the following filter options: population, high-need population, which has a number of filters, and just to name a couple of examples, there's Health Home Plus eligible, high Medicaid inpatient ER cost, on-track early psychosis filters, and state PC inpatient discharge within the past 12 months. There's the AOT status, and the AOT status filter has options such as AOT active court order or AOT expired in the past 6 months or past year. Then there's alerts, which include suicide and self-harm alerts such as suicide attempt filters, opioid overdose filters, PSYCKES registry filters for the suicide care pathway, high-risk list, and COVID-19 registry, and we also have an OMH unsuccessful discharge filter. Lastly, there's homelessness alerts. Here you can select shelter data coming from Medicaid or the Department of Homelessness Services. If the client has been in a shelter in the past year or safe haven, or if they are unsheltered, those are just a couple of examples of what is in the filter dropdown. A new social determinants of health, or SDOH section, has been added to recipient search, allowing for SDOH domains and or conditions to be applied when running group cohort searches. The SDOH section uses Z codes and Medicaid billing as a data source. In recipient search, the SDOH section will be displayed directly beneath the characteristics section. This section will function similarly to the diagnosis or serving setting filters, where SDOH domain categories will appear in a tree structure and can be expanded when clicking on the plus sign to view SDOH conditions within that domain. When running a search using the SDOH section, users will have the ability to select a domain category or expand the domain category to select a specific SDOH condition within that domain. Up to 4 different SDOH filters can be selected at one time. The SDOHs include societal and environmental conditions that can impact a wide range of health risks and outcomes. Then we have the Managed Care Plan and Medicaid section. Here you can filter by Managed Care Plan or Managed Care product line. We have the Medicaid enrollment status filter box, so if you're interested in seeing your clients that have active Medicaid, inactive Medicaid, or if their Medicaid recertification is due in less than 3 months, we have those filter options here. Some clients have Medicaid restrictions. For example, they can only go to a particular pharmacy, so you can search for that within this filter box as well. For the children's waiver status filter box, we use decay codes, so here you can search for serious emotional disturbance, medically fragile, etc. And you can also search by HARP status. HARP HCBS assessment status allows you to filter if the client was never assessed, if their assessment is up to date, if their reassessment is due in 90 days, or if their reassessment is overdue. Lastly, the HARP HCBS assessment results allows you to filter for the most recent HCBS assessment results, such as not eligible for HCBS, Tier 1 HCBS eligibility, or Tier 2 HCBS eligibility. The quality flag box in recipient search has a long list of quality flags that clients can meet criteria for. If you would like more information about a quality flag's criteria and who's included in the numerator and denominator, you can go to our website, psyckes.org, and select Quality Indicators from the left-hand navigation menu, and that page will give you the technical specifications for each of our PSYCKES run indicators. We also have the definitions hyperlink in the top right corner of this section, which will give you a brief description of the indicator. Next, we have the medication and diagnosis section, and this section does default to the past year for a look-back period, but you can change the look-back period by going to the little drop-down menu on the top right. Here you can type in the prescriber's last name or type in a drug name, which will have fuzzy search logic. So if you're not sure how to spell the entire drug name, the first couple of letters you type in will give you a list of drugs starting with the same letters. If you want to see recipients that are actively on the drug you've typed in, meaning the recipient has picked up the drug in the last 35 days as of the report date, you can select the active drug checkbox. There is also a new filter checkbox that has been added to identify individuals who have 1 or more prescription medication requiring New York prescription prior authorization. Active medication past 3 months requiring prior authorization. We also have psychotropic and non-psychotropic drugs below that you can select. Moving down the section, here's the diagnosis portion. So at the top, you can type in a specific diagnosis, and when typing in a diagnosis, you do have the option to specify how many times this diagnosis was given and if it's a primary-only diagnosis. If you'd rather not type in a specific diagnosis, we have a list of diagnoses below, and you would just click on the little plus sign next to the diagnosis category or header, and that category will expand to show subcategories underneath that specific diagnosis. Lastly, the behavioral health diagnoses are based on the DSM-5, and the medical diagnoses are based on the ICD-10. So this is a screenshot of the services by specific provider box. Again, you have the look back period drop-down menu on the top right of this section. The provider box will be pre-populated with your agency or hospital name. Below the provider name, you have the ability to look up clients that have been consented to your agency, have clinical emergency access in place, quality flag level of access, or attestation of service. You can look at those specific clients by using the current access filter. Next, we have service settings, and the plus signs here function the same as the plus signs in the diagnoses section. When you click on the plus sign here, you'll see all of the different subcategories. For example, if you'd like to find clients that have been served by your health home, you can click on the plus sign next to care coordination and select health home enrolled. Here is the services by any provider section, and this functions very similar to the box we were just looking at, except your agency or hospital name will not be pre-populated here. You can type in a provider name if you'd like to see, for example, if your clients are receiving care coordination services from that specific provider. Or you can leave the provider box blank, select a specific service setting like health home enrolled, for example, and see which of your clients are enrolled in any health home outside of your organization. There is also the new intermediate care facility for intellectually and developmentally disabled service settings that have been added to the recipient search service setting filters. So before we go into the bulk population management views, I'd just like to take a quick pause here and see if we had any questions come in.
Hi, Hannah. There's no questions in the Q&A.
Great. Thanks, Dee Dee. Going to move right along. So here we're going to perform a quick recipient search, and we're changing the limit results to option to 500. So here we ran a search using the service utilization filter, and we searched for inpatient mental health 2 or more visits. There are 233 recipients that met this criteria. Down below, you can see that this is the standard recipient search results page, so you can see the client's name, Medicaid ID, date of birth, gender, any quality flags that the client meets criteria for, the Medicaid managed care plan, and the current PHI access level. Now you can see in the upper right-hand corner, there is a Views dropdown, and let's say you're interested in viewing care coordination information on the results page. So here we've selected the Care Coordination Advanced View. So we have the same information displaying as before, but we're adding data that relates to care coordination, such as HARP status, and when you keep scrolling, you can see there is HARP HCBS assessment date, the children's waiver status, the health home and care management name if the client is enrolled. Then we continue scrolling, and we have ACT, On Track, and AOT. All of this information is included within the Care Coordination Advanced View. We also have the High Need, High Risk view. Again, we have the main information showing, but we've added a couple of other data elements. Here you can see OMH and successful discharge, transition age youth, OPWDD New York START eligible, Health Home Plus eligible, information about AOT and suicide risk, overdose risk, and PSYCKES registries. Then we have the hospital utilization bulk management view. This provides data on the number of ER and inpatient services in the past year. There's also the managed care POP view. So here we can see the Medicaid managed care plan, the POP index admission and discharge dates, the subsequent inpatient ER most recent admission and discharge dates, the number of POP care transition services, and then the most recent care transition services as well. And then we have the outpatient providers view, which shows the primary care assignment, the mental health outpatient provider information. Here you'll see the most recent provider facility name, the client's most recent service in the past year, and the number of services provided in the past year. The medical outpatient provider section has the same type of information. And you'll also be provided with the client's core or adult HCBS provider's name and their service information. You're also able to export all of these views to Excel. So let's do a couple example searches. So for example, if I want to identify recipients based on AOT status, I would log into PSYCKES and navigate to recipient search. I would then select one of the options from the AOT status filter, either active court order, expired in the past 6 months, expired in the past 12 months, or active or expired within the past 3 years. Then I would consider expanding the maximum number of rows displayed in order to see more than 50 names on the results page, and then I would click search. So what does that look like? I'm going to log in and go to recipient search and find the AOT status filter. Then I'm going to select the specific AOT status filter I'd like to search with. Then I'm going to expand the number of recipients that will be displayed on the results page and click search. So here we have over 100 recipients, so we would want to make sure that the maximum number of rows displayed is over 100 so that we can see all 103 client names. You can also see the filter you've selected at the top of the page, and you can export the results to PDF or Excel or drill into a client's clinical summary by clicking on their name to view more information. Say, for example, I'd like to identify recipients in a specific managed care plan. I would go to recipient search, select the managed care filter, and select a plan name. I could also add on other filters if I needed to, change the number of maximum rows displayed, and click search. So here I'm going to recipient search, finding the managed care filter. Then I'll select the managed care plan I'm interested in searching with. Then I might also add on a quality flag to my search, for example, the HARP enrolled, not health home enrolled flag. Then I would consider expanding the number of rows displayed and click search. So here's the results page, and you can see there were 138 recipients that met the criteria I searched for. You can see I searched for clients enrolled in the Metro Plus Health Plan who also meet criteria for the HARP enrolled, not health home enrolled quality flag. So again, I can export the results page to Excel or drill into a client's clinical summary. Now let's say I want to identify recipients based on their HARP status. I would go to recipient search, select an option from the HARP status filter, consider changing the number of rows displayed on my results page, and click search. So here I'm going to recipient search and locating the HARP status filter. I'm going to choose an option from the HARP status filter, for example, eligible, enrolled all, H1, H9. Then I'll consider expanding the number of recipients displayed and click search. The results page indicates 612 recipients were found that were eligible/enrolled H1, H9. So from here again, I can export or drill into a clinical summary. I can also change the view to care coordination if I'm interested in seeing a bulk population view related to HARP. If I want to identify recipients with any social determinants of health services, I would go to recipient search, find the SDOH conditions filter box in the SDOH section, expand the problems related to housing and economic circumstances condition by clicking the plus sign, consider selecting multiple filters at a time and expanding the number of rows displayed, and click search. So here I'll go to recipient search and find the SDOH conditions box in the SDOH section. Then I'll expand the problems related to housing and economic circumstances filter. Then I will select multiple filters from the SDOH conditions filter box, consider expanding the number of recipient names to be displayed, and click search. So here you can see that there are 294 recipients that met our criteria. And again, you can choose to export or drill into a clinical summary. Another example is if I wanted to search for recipients with any health, home, and care management enrollment or outreach. To perform this type of search, I'd go to recipient search, again, locate the services by any provider box, expand the care coordination service setting by clicking on the plus sign, and I'd select either care management enrolled or outreach or health home enrolled or outreach. I'll consider changing the maximum number of rows to be displayed and click search. So here I'll go to recipient search, scroll down the page, and on the bottom left, I'll locate the services by any provider box. Again, in the service settings section, I'd click the plus sign next to care coordination, and from the subcategories, I'd select either care management enrolled or outreach or health home enrolled or outreach. Then once again, I'll consider changing the limit results to filter to make sure we capture everyone and click search. So here I have over 14,000 recipients found for the health home enrolled or outreach filter. From here, I can export or drill into a specific individual's clinical summary to gather more information. If I want to identify recipients taking psychotropic or non-psychotropic medication, I can go to recipient search and locate the medication and diagnosis section. I could either type the specific drug name into the drug name text box, or I can select from the psychotropic or non-psychotropic options already listed. Again, I'll consider expanding my results and click search. So here we have the medication and diagnosis section, and I would either type in the name of the specific drug or select a drug from the filter box. I'll consider expanding my results, and then I'll click search. Finally, I want to show you what a search looks like when you're searching for specially protected data such as substance use, HIV, family planning, or genetic testing. So in this example, I want to see clients with alcohol-related disorders. So I'll go down to the medication and diagnosis section, and I'll find the behavioral health diagnosis box. Here, I'll find the substance-related and addictive disorders category, and I'll click on the plus sign. This will show me all of the subcategories, and I'll locate and select the alcohol-related disorder subcategory and click search. Here, I want to note that our search page will contain a 3 count, meaning you will see the number of recipients matching the search criteria, the number of recipients excluded from the search results because consent is required, and lastly, the number of recipients that are included in the search results because consent has been obtained. So I'm going down to the medications and diagnosis section, and in the behavioral health diagnosis box, I'm clicking on the plus sign next to substance-related and addictive disorders, and then I'll find the subcategory called alcohol-related disorders. Once I select that, I'll click search. So here you can see the 3 count I was just talking about. We can see that there are 4,576 recipients that meet our search criteria of alcohol-related disorders. There are 93 recipients included in our search results, and we can see their names below because we have their signed consent. Then we see that there are 4,483 recipients excluded from the search results because we do not have their consent. So now I just want to show you quickly how you can enable client consent using recipient search, and then I'll make sure to stop for questions at the end of the webinar. So to enable consent using recipient search, you're going to search for the specific client using one of their unique identifiers. A unique identifier would be the client's Medicaid ID, Social Security number, or first name, last name, and date of birth. First name, last name, and date of birth must be entered together. Once I've entered in a unique identifier and click search, I'll be brought to the results page. Here, it is important that you confirm the client on the results page is the client you are searching for. Then you'll select Enable Access or Update Access. Now you'll indicate why you're allowed to view this client's data. So here you can attest the consent was obtained, that there was a clinical emergency, or that the client is currently being served by or transferred to your agency. So in this example, we're going to attest that the client has signed PSYCKES consent. Next, you'll be prompted to confirm how you know that this is the correct person you're enabling consent for. You can either select Provider Attest to Client Identity, or the client provided one form of photo ID or 2 forms of non-photo ID. From here, you can cancel if you don't wish to go through with enabling consent. You can select Enable to enable consent and go back to the recipient search screen, or you can select Enable and View Clinical Summary, which will take you directly into that client's clinical summary. So here, you'll see after enabling consent for this client, the top right of their clinical summary says this report contains all available clinical data, and you have the option to show or hide data with special protections. So now I'm going to quickly go over training and technical assistance. On our public website, PSYCKES.org, you can register for an upcoming live webinar or select from a list of our recorded webinars. We also have PSYCKES user guides for each section of the application and short training videos for things like how to log in, how to troubleshoot a login error, how to create a PIN, and how to look up a client and enter consent. We also wanted to mention the self-service console. So the self-service console is a way to manage your RSA token and PIN, which are required for logging into secure OMH applications, including PSYCKES. The self-service console can be accessed at mytoken.ny.gov. And within the self-service console, you can set security questions to set up your account. You can reset your PINs if needed. You can activate your token, and you can request a replacement token. We recommend that all users set up security questions in the console so that you can reset your own PIN if ever needed. And as of April 2022, the console must be used when new users need a token or existing users need a replacement token. Lastly, here's our contact information. If you have a question regarding the PSYCKES application, such as how to run a specific report, you can contact our help desk at psyckes-help@omh.ny.gov, and we're available Monday through Friday from 9 to 5. If you're having difficulties logging in or you need a token and can't access the console to reset your own PIN, we have another help desk that can provide assistance. We have the OMH help desk for our provider partners or non-OMH employees, and we have the ITS help desk for OMH employees. Now, before I end here today, Dee Dee, did we have any final questions come in?
No final questions, Hannah.
All right, thank you so much, Dee Dee, and thank you everyone for joining. Just a reminder that these slides will be shared with you all after the webinar, and I hope you all have a great rest of your day.